After the first year, we already mentioned it was 2 to 3 fills in the first year, and after the first year is up, most patients will have to come back once or maybe twice before heading for their ideal weight. The band's a very, very nice procedure in the sense that once you're at your ideal weight, it'll make it very easy for you to maintain that weight off, and hopefully you'll never need more fills again. There are certain patients who will need to come back because they're having issues with either the band being too tight or too loose for certain periods of time, and we often see them. Now, with regard to the follow-up, I like to do my own follow-up with the patients because I've had the experience of doing over thousands of fills, and I typically know what to see, what to expect, and I'll know if a patient has been following their guidelines, or I'll know if they haven't just by seeing how the whole pouch and band and the amount of restriction that they have when they come to me. And in that sense, I always like to do that fill. The device that I use is an FDA approved device, so that means that they will be able to get some kind of follow-up done in the States. But that's something that may happen or may not happen depending on the surgeons. You have an option, even if you're in the same city, of going to see several physicians, and some of them will take on another surgeon's patient, and some of them will not. So that is very, very important for you to know. But typically, what we have found doing the follow-up for so many patients is that ultimately patients come back to me. Why? Because when they get fills somewhere else, they usually get anywhere from 5 to 7 fills in the first year. They wind up paying a lot more money. Plus, the follow-up that I do is basically at a very, very minimal cost to the patient. Just what materials are involved and the rental of the X-ray equipment, but that's it.